let's start with the liver, because we're going to go in this direction here. So this is the liver. We have the left and right halves. This is the left medial lobe of the liver. This is the right medial lobe of the liver. You can also tell that it's right medial. Not only is it on the right, but it has this gallbladder here. That's the gallbladder. Okay. Now it's divided by this ligament here that goes from the diaphragm all the way down into this area here, and that's called the falciform ligament. Okay. Now this is the right lateral, and this is the left lateral. Now the right lateral has a couple of lobes to it, so it's a little confusing. This is also, I wouldn't just mark this, but that's the reality of it. It's a little more confusing. This is the left lateral, and this right here, it's like a tongue. That is the caudate. Okay, right in the middle. It's caudate. Okay, so let's follow the gallbladder down into a duct here. This is the gallbladder. This is a duct. What would this duct be? Cystic duct. Very good. And then you go down towards the stomach and intestine, at least the duodenum of the intestine. You have another duct. What would that be? Common bile. Now, there's also some ducts that are very small here. The hepatic ducts, impossible to pin. Okay, so we don't have to worry about that. Okay. The greater and lesser omentum. This is the greater omentum. It is on the greater curvature of the stomach. This being the stomach. This is the greater curvature, so it is the greater omentum. The lesser omentum is on the lesser curvature of the stomach. So that's easy to remember. The esophagus. You have to know the esophagus is a couple of different areas. Up in here, that's all esophagus. And you also have to be able to identify it where it comes into the stomach here. Right in here. That's the esophagus. There's a sphincter here, or a valve. It's called what?
Lower esophagus.
Yep, very good. And then on the other end of the stomach is another valve, so you can keep all of the food in there while it's digesting. What's this valve called?
Pyloric.
Pyloric valve. Yeah, very good. And let's see the parts of the stomach. The bump up here above the lower esophageal sphincter is what?
The fundus.
Fundus. And this is body. What is this down here near the pyloric sphincter? Pylorus, conveniently labeled. And then what about in here? Yeah, rugae, and sometimes a little mouse head or something. But in this case, we don't have it. Once in a while, you do see it. Okay, and then
Reggie labels it.
oh, I'm sorry, the cardia. Yeah, the cardia is right here, just as the lower, the esophagus goes into this stomach. This area here is called the cardia. Very good. Okay, and let's go to the larynx next. Okay, up here, looks like a little tongue here. This is the epiglottis. It's above, epi to, the glottis. And the glottis is simply a hole formed by the epiglottis and these two folds here. And what are those two folds? Vocal cords, yeah, very good. And those are the true cords. The false cords are lateral to that. They're called false because they have nothing to do with vocalizing. Okay. Then you have, the important things to know about the larynx, which is the voice box right here, is it's formed by three cartilages: the epiglottis, the trachea, and the cricoid. The thyroid and cricoid. Cricoid, is down here, the thyroid is here, and the epiglottis is here. Now, often you're going to be asked something like, which one of these is elastic? And that would be the epiglottis. Then they could say, which one of these three is a complete ring? And that would be the cricoid. Which is an incomplete ring would be the thyroid. Okay. Now, here are the rings of the trachea along here. And they are lighter on this, and they are incomplete. There's a gap in the back where the esophagus runs down that groove, and when there's a bolus of food that goes down here, that little bump that is the bolus going down into the stomach, that needs a place to expand. You have that little ball goes down using peristalsis, and you have to have a little gap there. The gap is not just empty, it has a muscle, the trachealis muscle. That's easy to remember. Then down here, you have the trachea all the way to this bifurcation. What is this here? The carina. And on either side you have, what are these?
The right and left main.
Yeah, these are the right and left main bronchi. And they will go into the lungs on the right, on the left and the right, through a sort of a vague looking area here. Yes, very good. That's the hilum. And it just doesn't look like much here because it doesn't, some of the, like the kidney here, that hilum, you can see everything going in. But the capsule has been removed through energetic dissection. So you don't really see that much. So you have 3 lobes on the left and 4 on the right. So on the left you have the anterior, then you have the middle, and then the caudal. Anterior, middle, and caudal. Okay. On the right side, you have one extra one, just like in a human, but you added one on both sides. So this would be the anterior, this is the middle, this is the caudal, right here. And then right in the middle, that's the accessory lobe. Okay? And that is, it looks like it's right in the middle, but it's attached. You can see the vein here going to the right, so that's why they call that part of the right lung. Okay, and make sure I don't miss anything, Isaac.
Yeah, sure.
I've kind of got off course. Now we have from the stomach. If I was going to ask you what part of the intestine it is, I would try to make sure you had some reference to some of the other organs in the area. So if I mark the duodenum or duodenum, I'd show you the pyloric part of the stomach. So I'd put a pin right here. If it's the jejunum, I would make sure you could see this flower-like arrangement here, and I'd put a pin there. Now, if I wanted you to identify the ileal part of the small intestine, I would make sure you could see the large intestine. See how much flatter and bigger the large intestine is. So this would be the cecum. This is, what would this be? The ileocecal. And then this ileum. And then the rectum is way down here. Okay, so, did I miss anything on the intestine? Okay, yes, I did. Okay, so within the greater omentum, you see attached the spleen. That's easy, the spleen. But one that's a little higher than that, that's usually a little harder to find. This is the pancreas. I'd clear this out much a great deal more if I was going to pin the pancreas. But if you see anything in the great omentum and it isn't the spleen, just by ruling out everything else, that would have to be the pancreas. Okay? Now, the urinary system. Now, I could show you from this is the sheep, remember, and this is the cat. A couple of things you can see better on the sheep. This would be the ureter, this is the hilum. These right here are the calyxes that come down into the pelvis. The outside, which is a little lighter, is the cortex, and this is the medullary area, and these would be, right here would be the pillars, the renal pillars, which are medullary. Now the columns, or pyramids, I'm sorry, the pyramids. Now the columns you can't see as well in this, so I wouldn't pin that.
The renal capsules.
Oh, the renal capsule is better seen on the cat. It's right here.
Just the outside.
Yeah, it's just this protective outside layer. And this, I could pin this as cortex. This would be medulla. This would be hilum. I would give you a clue. I would say, is this a layer or a landmark? And often there's more than one correct answer. So from here, you have the ureters. And the ureters on either side will go to the urinary bladder. Okay. And from the urinary bladder right here, that is the urethra. Let's see if I missed anything here. Diaphragm is up here. That's where the falciform ligament is attached. I think that's it. This is getting a little dry, isn't it?
Pretty dry.
Yeah.